My name is Dr. Gabriel. I'm a board-certified plastic surgeon practicing in Vancouver, Washington. I think one of the biggest challenges in healthcare right now is that we're seeing patients who have not taken care of themselves. They may be malnourished with uncontrolled diabetes. They're not healthy and have not seen a provider. And because of COVID-19, many have had their surgeries delayed. Managing and treating these patients has become more complex, leading to higher risk of postoperative complications. Because of the complexity of surgical cases and increased patient comorbidities, I get asked, when should I use Prevena therapy? So I started looking at when this type of incision and soft tissue management is needed. We published a chart based on our clinical evidence to show exactly when to use Prevena therapy. It has all the patient criteria for consideration listed. From my personal experience, I'm looking at whether lymphatic drainage is going to be interrupted. In addition, I evaluate perfusion of skin edges and surrounding tissues prior to closure. If one or both of these aspects of tissue healing are interrupted, the patient is at high risk of seroma formation. In such case, we can use a modality like Prevena therapy. But why am I using? It's also a big question. I'm a fan of Prevena therapy because of the documented science. But Prevena therapy isn't your normal everyday negative pressure. And what I like about Prevena therapy is that it is uniquely designed to manage the soft tissue environment and help protect surgical incisions following primary closure. I also found it to reduce and normalize tissue stresses while bolstering appositional forces at the incision. In my experience, there's also an emotional benefit for the patient. With mastectomies or reconstruction, some patients are not ready to look at their incision. Prevena therapy not only creates a barrier to external contaminants, it hides the incision during those initial days of recovery. So my advice is that you consult our chart to determine your patient's risks for developing postoperative complications. And that if you're concerned about the incision for any reason, you should use Prevena therapy.